Hello, this is Laura Muratore, clinical psychosexual therapist. Welcome to my weekly Ask a Sexologist segment. I just wanted to thank everybody who wrote in. I've had probably the most questions I've had since I've been doing this past week, so I really appreciate it. Keep it coming in. Quick rule of engagement, please don't send anything super personal. I can't work with that. It's also not ethical for me to have your personal information in my inbox. You're more than welcome to ask questions relevant that are general for sexual health and relationships, and that's what I'm here to do. So please keep them coming in. I will get to as many questions as I can. I've just got a lot to choose from. This week I chose one person wants sex in the morning, one person wants sex in the evening. What do I do about that? Really good question. This is something that comes up daily in my clinical practice. Well, the first thing to point out is you both clearly want sex and you're arguing about whether it happens in the morning or in the evening. Well, you can keep arguing about this and who's going to give, or you both can compromise. And when we start talking about that, couples can really shift gears into looking at it a lot differently. So the person who likes it in the morning, well, maybe you will have to stay up a little bit later, once or twice a month, to help your partner and have this happen. In turn, they're going to wake up earlier for you. And this is just a nice thing that you're going to be doing for each other because you see the other person putting effort in, and it's going to make you feel valued, and it's also going to hopefully help you want to put effort in. So you're both doing exactly the same thing and sitting in the same boat, which I think is a helpful thing for a relationship when it comes to intimacy. What else can you do? You can look at doing things at different times of day. So I'm not quite sure if an afternoon is suitable. That really will depend on lots of factors, and I can understand and appreciate that might not be possible. We can look at weekend play, which a lot of couples do. And this is dependent on obviously your environmental factors, your lifestyle, if you have kids, don't have kids, and what you've got going on the weekends. But the weekends usually seem to be a good time for couples who actually can feel a little bit more relaxed. They don't have to get up for work, they don't have schedules. And so I would looking at different times on the weekend. And that will look like spending more time together and also taking things slow without having the pressure of it's the weekend and we have to have sex. That's not what we're looking at here. We also might look at incorporating just really low pressure sensual spaces in the morning and in the evening, and seeing if they progress to anything, and if they don't, it's still nicer to have something rather than nothing. So maybe in the morning, the person who's an evening prefers sex in the evening, they might state their preferences and what they have the capacity for in the morning. It might not be penetration, and it might not be other sexual related touch, but they might be up for intimate exercises or different things to do. So you would look at incorporating and enhancing that in the morning to help the person who likes it and prefers it in the evening, and vice versa. The person who prefers it in the morning, they're going to need stress-free, and they're going to need they might have low capacity in the evening. So in the evening, you're going to look at doing things that might resonate with them and be high pleasure, low pressure. It's a really complex question to answer, but what I really think is valuable is the art of compromise and looking at your sex window, because what is realistic? Rather than making it a tug of war, what is realistic to your couple? What factors do you have going on? And instead of thinking that sex is always going to be spontaneous and magical and organic, really looking at your sex window and putting it in when you both have the capacity to do so. And then also recognizing some person will have a low capacity, the other person's going to have a high capacity. So managing this and what you both want and can do together. Thanks for the questions. Keep them coming.